and I am seeing these numbers rise, which is always exciting. Let's give it one more minute and then we're going to get going so that we can cover all the great content today. So my name is Carrie Scott. I work at Spruce Health. I will be serving as the moderator today and introducing you to the concept of proactively shifting your practice to prevent burnout and improve the patient experience. We're going to be tackling a lot of really great content today. And I'm so excited to have Castle Connolly Private Health Partners with us, specifically Susan Greeley and Sean Connolly. We will get to our intro slide in just a sec. But on the next slide, I'm going to quickly run through the agenda with you today. And drum roll for that agenda. There we go. So we're going to do those intros that I mentioned. We're going to just quickly touch on what Spruce is for those of you who are new to us. We'll cover off on what CCPHP is. That acronym is short for Castle Connolly Private Health Partners. We're going to go over physician burden and burnout, the proactive steps for preventing it. We will talk about the current landscape of private practice today, and we'll go over a comparison of the private practice models. We'll also get into how to choose a model for greater efficiency and engagement, how to deliver an improved healthcare experience inclusive of communication and technology, and then we'll take your questions. On that note, feel free to drop your questions into the Q&A. We won't be using the chat function. So Q&A is where you're going to want to put those. And if your question is relevant to the content that we're covering in that moment, I will send that over to whichever speaker is presenting. Otherwise, we'll save it for the end. So we can do a combo of questions throughout and questions at the end. This is also being recorded. So if for some reason you feel like you've missed something or you want to revisit the content later, I'll be sending out a link to all of this after we wrap, so you can go back. With that, let's go to the next slide and get some intros underway. Since these three know themselves better than I do, I'm going to let them introduce themselves. Let's start with you, Susan.
Susan can unmute. Hi, everyone. Thank you, Carrie. Thank you, Jess and Carrie, very much for having us here today. I'm really excited to share this with you. So I'm Susan Greeley. I am the Senior Vice President and National Director of Wellness Services at Castle Connolly Private Health Partners. I'm here today with nearly 30 years of experience in the healthcare industry, which I am very proud to say. I'm a registered dietitian nutritionist, and I run what is called the Sun Solution Wellness Program at CCPHP. We focus on sleep, exercise, nutrition, and stress management. And my world revolves around engaging our physicians and our patients, which we call members, to lead healthier, happier lives, and really, helping physicians practice in this way that serves everyone best. So I will be talking a lot about all of that. And again, I'm very excited to be here. Thank you for all of those who've joined us today.
Great. How about you, Sean?
Hi, I'm Sean Connolly. I'm the COO at Castle Connolly Private Health Partners. I'll talk in a moment a little bit more about who we are. My background is actually primarily sales and marketing. I only entered into healthcare about 6 years ago when we started Castle Connolly Private Health Partners. So I have a lot of background in consumer communications and B2B communications, and particularly, how to talk to patients, which has become very relevant as healthcare becomes more and more consumerized. And we'll talk a little bit about that and the impacts it has on patients and physicians later.
Right.
Hi, everyone. I'm Jessica Goulash, or Jess. Thanks for joining us today. I'm really excited about today's webinar, specifically, a couple of reasons. One, I have been seeing CCPHP or Castle Connolly, I guess you could say, on doctors' offices for the last 20 years. I was an in-office sales rep for doctors, and I saw their, Best Doctors of America stuff on the wall. So when CCPHP came to us 6 years ago, when I was at, just when I was getting started at Spruce, their name was quite familiar. And so I was really happy to sign them up as customers in their primary care division. And so I signed them up 6 years ago with Spruce. And so that's why we wanted to have them on today to talk about their business and also how they use Spruce. I have worked with all types of healthcare professionals prior to Spruce, but also at Spruce, we cover anything from primary care, both fee for service, insurance taking, and we have a ton of other specialties like surgeons, mental health, etc. And I'll get more into about Spruce, but that's my experience just helping healthcare professionals improve their communications with their patients every day through Spruce. All right, well, we'll go to the next slide unless there's anything else.
No, that's perfect. So from here, I'm going to let Jess take it away and pass the baton, and I will just be in the background facilitating questions and such.
Yeah, so Spruce Health is a healthcare communications platform. We do pretty much all the types of patient communication you could ever need, from anything from your business phone system. We do in-office desk phones to virtual phones that you can use on your cell phone. And we also have an e-fax as well as full texting capabilities, both by SMS, two-way communication, and a mobile app your patients can download to message you, do video calls, send you payments. And then all of our great tools are available on the computer or on your mobile phone and collaboratively for your entire care team. And that's what really sets Spruce apart, is that you can collaborate around communication. Nothing is ever set just to you. And again, we have a lot of different types of customers, and one of which that was an early adopter of Spruce are concierge or membership-based practices. Because when I first started, they came to us because they were all giving out cell phones. And so Spruce was a really great way to be able to have cell phone-like access for your patients, but also have it collaborative with your team and have ways to create boundaries so patients don't go directly to your cell phone 24/7. So, but we also have just a ton of just insurance taking practices that use Spruce, and we'll give you our contact info at the end if you need to learn more. All right, I'll let Susan and Sean take over.
Yeah, so actually, Jess mentioned earlier, but Castle Connolly Private Health Partners is essentially an offshoot of Castle Connolly Top Doctors. About 40 years ago, my father, John Connolly, and John Castle realized that there wasn't a good resource for patients to find top care. And they really thought that was missing in a world of restaurant reviews and movie reviews. And they set out to help people identify top care through a peer-nominated system. Almost 10 years ago now, what we saw in the market was even Castle Connolly Top Doctors, some of the most well-established and recognized physicians, particularly in primary care, were not thriving. They were struggling with the business model as it had become more transactional. And we started Castle Connolly Private Health Partners to really help enhance the practice model, give these private practice, smaller primary care doctors a way to thrive in business and in the way they care for doctors. We remain very affiliated with Castle Connolly Top Doctors, which is now a part of Everyday Health, one of the largest health media companies in the world, with over 75 million visitors per month. So we're a group that really partners with physicians. We establish membership-based companies on their behalf, and we help them and their patients thrive in primary care. This is just as evidence of that. These are some of the statistics we've gathered about our model and the difference it makes for the physicians we work with. 98% of our physician partners have renewed their relationship with us. We have about 120 to 130% growth per year in revenue. That's not necessarily in patients, because there is a limitation to a patient panel in a membership model, but that's in revenue. Most of our physicians have been selected as Castle Connolly top doctors, and that's a primary source of our partnerships. And the average size of our concierge model programs is around 400 members, which is very robust for a concierge program, but not nearly the level of patients that a lot of the current primary care doctors have to try to maintain.
When you say members, I was just going to clarify to the audience. You mean so your practices have on average around 400 patients on their per physician? Is that just to
Yes,
clarify that?
we refer to them as members because they're part of this membership model, and they're paying an annual subscription to participate. But the subscription allows the physician to really cover all of their overhead costs, to no longer rely on the transactional nature of coding procedures, so they can slow down, spend more time with patients. So it's around 400 patients in a practice.
And what's like an average that a traditional fee for service would have?
Probably somewhere near 2,500.
Okay. All right,
A lot of our
comparison.
partners, when we start with them, are somewhere between 2,000 and 3,000 active patients, in the last 24 months. And they end up with somewhere between 300 and 500 members, and are able to spend a lot more time and attention with each of them.
All right.
That's me.
Yeah.
Thanks,
I'm
Sean.
going to take over now.
Yes. Yeah. Thank you both. So we just heard that's a big driving force in why physicians are seeking a different way to practice. So we have a very, very large, big concerning problem in this country in U.S. healthcare, which is physician burden and burnout. So I will be talking about that burnout situation and also how we can take proactive steps to prevent it. So because it is preventable if we are proactive, and it's also imperative because physicians and patients, which we refer to them as members, as we say, and I will use that term interchangeably, whether you're a patient, whether you're one of our members, we all deserve to thrive in both our work lives, our professional lives, and our personal lives. So how do we tackle this problem? Well, I'll start by defining what burnout actually is. And it's interesting because it's a concept and it's a condition and it's a phenomenon actually that has been around, like this has been explored since the early 1970s, where this book was published called Burnout, The High Cost of High Achievement. And the author, Herbert Freudenberger, did define burnout as the extinction of motivation or incentive, especially where one's devotion to a causal relationship fails to produce desired results. Now, that's a problem when it comes to practicing medicine, isn't it? So it's also a syndrome, and there are other characteristics of burnout. I think the most common that we can all relate to in some way is feeling exhausted. You feel that you simply literally have all of your energy depleted, and it goes beyond just being tired. I mean, who can't say that they're tired after a long day's work or the long work week? But once it's leading into burnout, there's true constant depletion of all of your resources, personal resources, meaning the way you function in your daily life. Another characteristic of burnout is when you feel very cynical or negative towards your job or your workplace, unfortunately, and that starts to seep into other aspects of life. We also can characterize burnout as when you unfortunately see a reduced professional efficacy. Now think about this when in terms of, again, of physician or the medical system. That's very, very concerning when you no longer are effective. In other words, aren't practicing at your top game, then lives are actually at stake. So this is why, we won't spend too much time talking on the negative consequences of burnout, but they're very, very real. Okay, the next slide. Yeah,
Hey,
so
Susan, real quick. I was thinking we might want to serve up a quick poll if that works, just to
Oh,
get a
yes.
sense of whether the folks who've joined us today have ever experienced burnout. So if y'all could just real quick with a yes or no, we can get a sense of how you've been feeling. Give you a couple more mins.
Has it ever impacted job performance?
Yeah. Okay. All right, y'all. I'm going to end the poll if you haven't weighed in. Okay. All right. So I'm going to share the results of the folks who answered. So you can see that the lion's share have absolutely experienced burnout, which is pretty normal, I would imagine.
It is. That's high, 82%. That's
Mm,
not surprising, unfortunately. And so let's take a step back even, and what causes that burnout? Because burnout is an extreme situation. It's workplace stress. And most people, we just saw 82% of us here. I know it's a small number perhaps, but that's really indicative of the whole population, regardless of what area of work you're in. Most people in the workforce experience workplace stress. So it can be an issue for all professionals at all stages of their career, early on, later. But the most important part of that is when it's poorly managed, it does lead to burnout. And we're all familiar with this during the pandemic. Who didn't experience some type of witness burnout or experience it themselves? And with physicians in particular, we have seen a dramatic increase over the last 5 years. There was an 11% jump between 2018 and last year, and that has increased steadily. We're now at about 60% roughly of all physicians report some level of burnout. That's quite alarming, isn't it? So what are those causes? Number one is workload, and physicians have extreme workload. And we know that they work very long hours. It's never ending. When Sean was describing those patient panels, when you have 2,500 patients and they all need something, that can be really, really overwhelming and lead to extreme workload that just doesn't seem to end, which work-life balance then suffers. And that's another key area of the stress, and interpersonal relationships. So it's all tied together. And those are the causes of the workplace stress, or the contributing factors. And what we see, though, unfortunately, is that work-related stress, it is responsible for 120,000 deaths in this country annually, just in the workplace-related stress alone. Well, let's keep going on to the next slide. All right, so there is a big cost of burnout, both mentally and physically, and this is well acknowledged. I talk about stress in my daily life. My wellness program, I mentioned, we focus on sleep, exercise, nutrition, and stress management. Why? Because stress impacts everyone, both mentally and physically. The impact on, and so we could spend a lot of time talking about the, everything from depression to heart disease, but unfortunately, it's, not a pretty picture. As far as the impact on the economy, we do know that primary care physicians burn out and quit their jobs, and that's a very high cost on the economy. The total annual cost of physician burnout in this country is over $4 billion, and that's across the healthcare industry. For primary care physicians specifically, who we work primarily with, it's over $260 million. So this is a very steep cost, and we all can acknowledge the toll that stress takes on everyone. So now it's time to talk about solutions. This is my favorite part, because I'd rather talk about solutions to the problems than the problems itself. And it's important to point out that physicians are leaders. They're leaders in their job, in the communities, and so many people look up to physicians to be an example, and they do lead the way to well-being and wellness. So it's important for taking a different approach and speaking directly to physicians. Be honest and open about your own struggles. And I think that that's something that is being talked about more. When a physician talks about well-being and taking steps to set their own boundaries and prioritize their own health and well-being, people watch, they listen. Who doesn't learn by example? We all do. And we seek out positive examples. And people want to observe, when things go in the right direction. So that's one thing that we really focus on, is supporting our physicians so that they can focus on themselves. And that trickles into every aspect of their life, and obviously then improving the care that they're able to deliver. So setting themselves as a priority in their own lives is important. Sometimes the signs of stress are actually overlooked, and that's something to discuss one-on-one with patients. In a model, the membership model, when you have more time, then physicians are recognizing it more in their patients and in themselves. So as far as walking the walk, that's one area that we really, more and more, I think it's important to have these conversations and support physicians to walk the walk of wellness and well-being. So one way to get there that we're talking all about today is how to transform your practice. What are the tools to get you there? And the most important thing to do is think about how you practice and what control you have over your actual practice and your business model. So with that, I am going to turn it back over to Sean shortly.
Yeah, Susan, I just wanted to add something. Like, I always think of the analogy, if we don't take care of ourselves, we can't take care of others. And it's no different with physicians, because they are taking care of everyone. And the example I always like is in the airplane. They always say to put on the oxygen mask on yourself first, because you can't take care of anyone else on that plane if you're not breathing.
True.
So I think this reminded me of it. And I just never really thought of it as, if our doctors aren't doing well, how can they recognize us not doing well? Or can they? And are they going to be at peak performance? So I love these points. But now we can pass it off to Sean. I'll go to the next slide for you.
It's a good analogy. So we want to make sure that folks realize, that there are choices in how your private practice operates, and those choices can make a big difference in terms of your susceptibility for burnout. A lot of physicians feel stuck. They are too busy to really consider their options or think about another way to operate their small business. And they get overwhelmed with the burdens of not just being a doctor, but being a small business owner. And so just briefly, we want to touch on some of those fundamental differences. So if you go to the next slide, we look at a traditional, or what we describe as a transactional model. And so this is the typical insurance reimbursement or fee-for-service practice, where you're seeing patients and performing procedures, coding things, getting reimbursed. Those physicians, and we touched on the size of their patient panels earlier today, but that translates into somewhere between 11 or as many as 30 patients a day. It's a massive, massive workload. Physicians in this model, where they're really churning, end up spending only about 27% of their time with patients, whereas they spend 49% of their time on desk work. And I'm sure this is true of everyone in the audience. It's true of every physician I've ever met. They did not get into medicine for the paperwork. They got in it for the patients. And so, as a result of this, 50% have thought about or wish they could change their work situation. And not unlike the numbers we saw in our poll earlier, 61%, report experiencing feelings of burnout. It's more than 50%. It's a scary statistic. Exacerbating that is if you're in a transactional model and the environment changes, such as during COVID, when people weren't coming into offices, people were, staying safe at home. There's a risk to your business, and that can exacerbate, obviously, the stress involved. About 72% of typical primary care practices saw an income reduction in 2022. Now, by comparison, if you look at a concierge or subscription or membership-based model on the next page, those physicians are seeing about 6 to 8 patients a day. They're reporting 96% career satisfaction. So they're obviously very happy with the way they're working. And a lot of that has to do from the focus on patients versus volume versus trying to achieve a certain number of transactions a day, and then having to do all the corresponding paperwork. 24% actually saw some income increase during, because people were seeking out doctors that they could rely on to see them and be proactive. This ability to spend more time with each patient is not only satisfying to the physicians, it actually has been shown to translate into fewer hospitalizations and ER visits. It basically enables the primary care physicians to be more proactive and more preventative and less reactive. So, which, if nothing else, seeing their patients do better creates a very high level of satisfaction and gratification for the physicians. So while Susan will talk about a lot of the ways you can implement self-care and care for yourself in the same way you care for patients, it does start sometimes with the business model. And we wanted to make sure folks knew there was a choice, and, that we can talk more about that if you're interested.
Yeah, I wanted to pause for a second and just remind the audience we will be recording this, so we will be sending it to you if you have a patient in the next couple of minutes. Second, I also wanted to share, if you hover over the screen, you'll see a little button for the Q&A, and you can ask any questions you have for anyone on the call, and just about membership models, about burnout, all of that. We encourage you to interact, but we'll keep moving along if not.
Oh, sorry. Okay. So that's me. On that note, so thank you, Sean. And I'll just kind of summarize a bit more about the practice model that really can help physicians seek more, find more efficient ways to practice and becoming more engaged themselves and engage more of their patients, which translates into a much more positive overall patient experience. So a summary of the membership model is that there is a reduced patient panel. And this, time is valuable for all of us. No one wants to feel like their time is wasted. Nobody wants to feel like their time is not respected. And on the other hand, too, when you're with your physician, you want to know that they are present and able to be with you in that moment and not rushed off to the next person. So those reduced patient panels do help physicians achieve that quality of time with their patients. So the more time with patients leads to better care and less miscommunication. You're covering all of the issues. Also, when you have fewer patients, when your panel is lower, there is a much smaller burden of all that administrative work that Sean was referring to. And I know so many physicians who do spend their weekends catching up on their notes, and that's just part of the healthcare system, and that creates so much of that workload and burden. And thankfully that's decreased with the membership model. We really leverage marketing and technology, and this is a key area, and just that's what you and I are now going to talk about, because the human aspect is the most important key part. You see your physician because you like your physician, and that's a very trusted relationship. And to improve the entire experience in this day and age, we can't discount the fact that we need to leverage technology. And there's so many options out there, and there are very, very helpful tools. And that's something that we want to highlight today, because it's what helps create a much more efficient practice. It increases the collaboration, it streamlines processes, and does, in my world, it's what makes it very, very collaborative. And I really enjoy talking about that. So we're going to spend some time talking specifically about that. And when I introduced myself, I did say that I run what's called the Send Solution Wellness Program. I have a team of health coaches, and we work in collaboration with our physicians to engage more members, to create a overall very much, I want to say, well-rounded experience, meaning that the coaches end up being an extension of that care team. So the physician meets with their patients and they have these recommendations. They want them to see, positive improvements in their overall lifestyle, and we'll call outcomes, of course. And how do they get that? They're one person and they can't be all things to all people. But when you work in collaboration with a team of health coaches, you can achieve that. And it's very effective and such a positive experience on all sides, because that coach can help the physician bridge the gap between the recommendations and then, like we said, the outcomes, or just overall taking steps to act on those recommendations. And becomes hard in people's daily lives. So that follow through is there once you have a collaborative team. And the accountability, as we all know as well, is a really important aspect for achieving improved outcomes. This preventative care approach is intended really to be for both physicians and the patients. It's not just that your patients can receive health coaching. And this is why I talk about it, because physicians are no different than anybody else. In fact, they succumb to the stress probably much more so and more frequently than other people in other careers. But in any case, I encourage a physician to find some sort of coach as well, or work with the health coach, because it is the antidote. Like, it's what I do. And so of course I believe this, but it's important to really make people aware. I educate and support others by making them aware of what's available to them. And it is a great antidote to burnout. So that's a key message that I want to share with people today, is how that health coaching, or, the coach can really reduce the burnout, and it's stigma free. Too many people reach for substances and other unhealthy means of managing stress rather than finding the support that can actually help. So I don't want to overlook that. And with coaching, this is an unbiased, and it's non-prescriptive, and it's non-judgmental on all sides. So it's really a win-win. And when we're talking to be proactive and talk about prevention, it's really important to find collaborative relationships and the tools and resources. So that's the human touch, and it is high touch and supportive. And then we, as I mentioned, need to leverage technology. So
yeah, Susan, I wanted to pop in. So I've been working at Spruce for 7 years, and I see a lot of the inbound sales, that come in. And so we have a lot of customers or potential customers that are coming in, and so we see some trends in healthcare, right? When I first started versus now. And there's a big digital health kind of revolution right now. There's a lot of companies trying to solve kind of different disease states. And we see over and over this health coaching model. And so for those on the call, you may be a health coach, you may be a physician, you may, who knows, or staff person. So, but this coaching model to have kind of this assist to the provider, I think is really trending. And I think we're only going to see it continue. You guys have adapted this to be along with the concierge model, which I think is super interesting. I have some health coaching companies that focus on cardiology, like high risk cardiology patients. And so when they're, when they get out of the hospital, they have a health coach that's following up, making sure they're doing everything and checking in on them, because we see such better outcomes and less readmissions and less ER visits, like you guys talked about before. So I just love to see kind of the two worlds that we see a lot at Spruce, the coaching and then the concierge kind of molded together here. So it's an interesting model you guys have. I also saw some questions. I'm going to save them towards the end though. Okay. So we will get back to you and at those questions at the end, but we're going to keep moving through the slides here for now.
Okay. So I mentioned, I was talking about that personal touch, and but then the leveraging of technology as well. I think we have to move the, yes, one more, exactly. So I've already said this, but I'm going to repeat myself, that what people are seeking in their relationship with their physician is that in-person visit, that nothing can replace that, honestly. And we see much more satisfaction among patients and much more engagement when they do have that quality time in person with their physician. But let's say that's only one time a year, and that could be the case, because in between they have ongoing communication and they are able to get their questions answered quickly. They're able to have contact in between in-person visits, and in my world, work with a health coach as well, so that bridges the gap. But that said, this is really important to say that it is that combination of the in-person meetings with your physician and then leveraging the technology that I keep talking about to create an even more personalized care. And that's the interesting thing, is that we really, Jess and I, that's our world, using technology to enhance that personalized approach. And my team and I have this ongoing communication literally daily. As we're doing this webinar, the physicians are speaking with some of my health coaches regarding certain patients and their experience and asking questions, and it's very timely. And then the patient feels supported in the moment. We don't have gaps in time returning phone calls and trying to listen to voicemails and things like that. So we'll talk more about the specifics, but that's where, in conjunction with the in-person visit, that nothing replaces those one-on-one relationships, we do use technology to enhance the entire experience. And so in two ways, technology helps create boundaries, because even though we want high touch, we want personalized care, everybody needs to have set boundaries. Otherwise it can implode, honestly. And right?
Oh, yeah.
So it's both ways, establishing boundaries, but creating those efficiencies at the same time. And it really does reduce miscommunications. It sets expectations. Things flow better when you have those boundaries in place. So I already mentioned decreasing communication gaps and overlaps, because sometimes a patient gets scared and confused, and so they'll call, they'll email, they'll do that, they'll do multiple channels rather than having one streamlined channel. And that's important to say too, because we all can relate to that. When you've got, messages in 3 different ways, it's too much. So once we can streamline things and use technologies, and that there's no one right or wrong, of course. We live in this age of so many resources and tools and apps and options. So exploring those and really finding best practices is also extremely important. When you're trying to truly transform your practice, what works, what's already established, learn, as I said, by example, learn from experience. And that helps to increase productivity and truly decrease communication inefficiencies, which, the world is fraught with. So in any case, in this model, or the membership model, what we see, which is, when a patient works with a concierge physician, they report 98% satisfaction.
It's crazy.
Yeah, in an excellent way. So, okay, well.
Yeah. And, it's just, all this is bringing up so much. So I did want to give a quick little fact about Spruce. So we started as a company, one of the things that we saw a deficiency in healthcare communication was a lot of it was very siloed. You'd call the office, you get the front desk. They would then have to take a message and get it to someone, or transfer the call to a voicemail. And then we also saw that you would maybe message in on a clunky portal, and it was again siloed. Or after hours, you would get to an answering service that couldn't really help you, but could help you, but couldn't really. And then they would translate it again to the physician, and then the physician would get a page. And so there wasn't a ton of methods 7, 8 years ago, actually, where you were collaborating around the incoming patient communication. So over the last 7 years, that's really what we focused on building, was letting patients communicate however they want. I mean, we can't force them. They're going to do whatever they want. They're going to call at night. They're going to text your number, even if it doesn't say text you. So let's make it easier to handle those incoming requests,
Right,
so that so your mind doesn't have to think, do I have to check multiple things? Another thing we see very frequently in phone systems is patients will call and hang up if they hit a phone tree. So Spruce really documents all this, so there's less redundancies. So then you could be more efficient at delivering that response to that patient that called 3 times and hung up. Or if they text message, your whole team can see it. So kind of like the health coaching model, you could have your front desk or your staff person, admin, MA, see the text message or the voicemail first. And then you have to have a tool that allows you to escalate to the right person at the right time, and make sure not everyone's getting notified of everything, because then you have notification fatigue. So, make sure you use a tool that's collaborative. Obviously, I think we have a lot of customers on this call, and what we do here at Spruce is combine all the communication tools, and then allow you to collaborate as a team. And then you have to also use technology in a smart way. Set up schedules. So during the day, if a patient messages you, they get a message automatically immediately back saying, you know, how long you're going to take to get back, what the next action is. If most of them are coming in to book an appointment, maybe you want to send them to your EHR. Who knows? And then at night, you have a way to designate that their messages won't be checked till next business day. It will, and they can mark it if they want to mark it as urgent. Just because you're in concierge, just because you offer texting does not mean you have to offer care 24/7. And I have to coach my new customers that come to Spruce on this because it's very fearful. And there's actually, we have a blog post that shows, maybe we can link it, but a blog post that showed that if you give your cell phone number, which can be kind of a fake Spruce number that routes to different people, but if you give your cell phone number out to patients, they actually don't abuse it as much as you think. And they actually, it makes them feel like you believe in them and you trust them more. And so then they are more likely to follow your directives as a physician giving you patient care. It's amazing, the stats. So I'll see if we can find that and link it. But it's a great stat. And so this is the world I live in, talking to people, coaching people about this. Spruce also allows for you to automate when someone calls in, it goes to a specific team and then they triage it, or you can page a specific teammate. So you mentioned, you have a health coaching, you may have, you can have the health coach say, hey, Dr. Gulish, I'm concerned about this. What do you think? And you can do it virtually, so you don't have to move desks, all that. And so I have some examples of this. On the right side, you'll see Ari. He texted about a question in the morning. And so we said, hey, you've reached us after hours. Mark it urgent if you want. And patients love this because, like you said, I think, Sean, or, that they like you as a physician and they don't actually want to bother you most of the time. Most of the time. There are exceptions. So this allows the patients to be like, I just thought of this. And so I want to text them, but I know it's not going to bother them because they're using a technology that will only notify them when it's urgent. So these are all little things that add up to make this kind of business model work. And then we also, Spruce allows for SMS texting. So patients don't even need to download an app, or you can have everybody download the app and it's their one-stop spot for their concierge or their medical care through for your practice. So there's lots of options. Again, it's all about flexibility for what your business model needs and what you, for your own, non-burnout needs, need. So those are some of the things. And I know, Susan, you use Spruce on the daily. So if there's anything I missed, please feel free to add it in the next slide or this slide if you want.
Right. Well, you said so many things that I think are so important for us to reiterate in a way because of the fear that comes in. And I think the fear of the unknown and how's this going to do this? And oh my gosh, I'm reachable 24/7, as you just said. And when we say that, it's true that once you establish, you give them those directives that, hey, yes, don't forget, you're waking me at 3 a.m. to ask about a prescription refill, not necessary. So you give these directives and everybody respects that, right? When as a patient, you can then understand if your physician says, just because you can doesn't mean you should message me.
The beauty is they can message at 4 a.m., but you have technology to tell them, hey, this isn't going to be checked till next business day unless you really think it's urgent, because we really want to make sure to take care of those urgent.
So
I can.
Go ahead,
sorry, I was just going to say, Jess, I can tell you that every one of our 70 plus physician partners, when we're first talking to them and they see, 24/7 communications is a part of the sort of VIP service that comes with the concierge program, they always say the same thing. They're like, oh God, I don't want to be on call again.
Yep.
And we explain to them that having the ability to reach out to the physician gives people a level of confidence and trust that actually alleviates anxiety.
Right.
So some of the most anxious patients are anxious because they don't have the time with the physician or the ability to connect with the physician to get all their questions answered. But when they have that through something like Spruce, they're actually much less anxious. And as a result, less high maintenance, believe it or not. It's such a confidence builder for the patients.
Yeah. Counterintuitive, and it's true. We see that in practice. And you said, and the flexibility, there are so many positives of this type of technology for sure, and the being 24/7 reachable. But so I did want to go through some of what we see with our physicians that we surveyed, just to give an example, real life examples of how our physicians use this. As you said, Jess, I use Spruce constantly during the day. I interact with my team and all of our physicians, and it's quick, it's easy. And so that's what we see. And I just wanted to make sure I'm not the only one who feels that way, and really appreciate the quick collaboration. We get things done very efficiently, questions answered. So our physicians felt the same way. And I put in a few quotes here. They are able to answer patients' questions very quickly, very directly, very succinctly, and there's nothing that can replace the value of that. I know that might be a little intangible in that sense, but when you can quickly respond and just check it off. One of our physicians says she gets at least 40 messages a day during her workday. Now that sounds crazy, but it's not. Think of how many text messages you answer in your personal life, right? And then you check and it's done. It's a lot faster than a patient calls in, leaves a message, somebody has to listen to the message, and then somebody has to call them back, whether it's the doctor or the staff or all that. So that efficiency is just tremendous. Patients appreciate, I'm trying to see what I wrote here. Yeah, how quickly they can respond, they clarify points. So they can also do very quick and easy telemedicine. So for our physicians, what we love is saying, okay, you just cut yourself, or you have some crazy rash or on vacation down in the Galapagos, and you can do a quick telemedicine visit through Spruce. I don't know where I got that, but it sounded good.
No, we hear
I'm like,
the
yeah.
craziest stories. I mean, we have physicians that will tell us they are like on a plane and they were able to get their iMet, the Wi-Fi and connect and help a patient while they're on a plane with the Wi-Fi. Like, it's really
spontaneously in that sense. Or say the physician can respond, I'm in with a patient, I can call you via the video. So when I say telehealth, there's a video function in Spruce as well, and they can say, I'll do that in 10 minutes, find a quiet spot, whatever. So when it works.
It's a huge asset for snowboard patients, whether you are their physician at their seasonal home or their home. You can really provide care for them all year round, and it helps patients set up a single stream of communication and relationship with one physician rather than juggling back and forth. So we've had many folks, for example, in New York who spend a lot of time in Arizona or Southern California or Florida, just stick with their New York physician as their primary care concierge doctor, because they can still connect with them, get the advice that they need, the referrals that they need when they're in their seasonal home.
I'm just on a road trip, and we have so many scenarios and day to day and going back and forth between home and office. So it's the bottom line is it creates such quick, easy communication. And when we're talking about increasing efficiency and engagement, I honestly can say how valuable it has been to our physicians and our patients to help create that through technology, i.e. through using Spruce specifically, has been the key part of that. So just to summarize all of this great transformation we're trying to get to in physicians' practices, when you update your model, and as Sean said, and we've all said, we have choices. Every physicians have choices, and understanding what is out there at their disposal is very important, because then you can make a decision proactively, hopefully, before you're at this place of complete burnout where your practice has suffered, your health has suffered. So in any case, truly transforming the physician practice to one that is healthy all around creates happy, sustainable, fulfilling practices for patients and physicians. That's what we strive for. And I really hope it was our intention to give all participants, whoever's joined us today, an understanding of what is out there to seek out these tools and resources and services that we provide and can help you get to that point. We're all about, so at CCPHP, we really do believe in well-being of the, wellness and well-being of our physicians and patients. They all deserve to lead healthier lives, and physicians deserve to practice the way they are intended to practice. Patients do deserve exceptional care. And so that's what we strive to create. And with the 4 C's of, connecting patients and physicians in an efficient way, having a collaborative approach, it's very convenient. And then we offer the coaching on all sides. And overall, that also leads to just tremendous cost savings as well. With that, I want to, I believe, finish with one final quote that I grew up with. Just on a side note, my father always used to say to me, and I have to say it was an ancient proverb, that physician, heal thyself. That power is within you to heal yourself. And I say, and thy practice too. And we're here to support you to do that. So thank you all for listening and for joining us. And I think we're ready for questions if there are any.
Few questions. We have, around 8 minutes left. So one question is about your services you guys offer. Okay. And if it's too complicated, we can always have them email you and set up a call to discuss. But someone actually already has a direct primary, like a membership-based practice, okay, on their own already, but they would love to incorporate some of this coaching. Do you have kind of some resources like that, or do you have options like that, or recommendations for who does?
Any and all of the above. If they
Okay.
So we'll provide our contact information, I would say contact us.
That's going to be here.
Yes.
Okay, yeah. So thank you. That was Michelle. Thanks for that question. You can reach out to Susan by scanning that QR code to the right of her name, or typing that email, and we're also going to include it in the follow-up email of the recording. And then another question. So if someone were to become a concierge model with CCPHP, are they independent, or do they work for CCPHP? And I'm sure that's a common question. So I'm sure
It is. Different groups like ourselves that assist physicians in this transition operate in different ways. We really value the independent private practice physician. And so our structure is that we actually create a joint venture company with the physician. The physician remains entirely independent in their medical practice, and they are a majority owner of the membership company that we create on their behalf. And then we handle everything related to establishing that membership company. So complete independence, in fact, majority equity in a new company, which based on the membership growth can have significant value over time, in addition to the medical practice itself.
Those are the main directive questions we got. If there's Susan or Sean, if there's any other kind of tidbits you want to say before we go to the next slide, which is talking about our next webinar. Obviously, this is the contact information. So if you guys want to say a last bit, that would be great.
Sure, I'll go first, and just again thank everybody for joining us today. And we absolutely would, be thrilled to answer any follow-up questions that you might have. Whatever it is regarding our model, the membership model, the coaching, and how we collaborate with physicians, please do contact either Sean or myself. And this was really a pleasure to be here today. So I wanted to thank you, Jess and Carrie, for having us, and truly for our ongoing partnership with Spruce. It really, helps in our daily lives and what we do.
Thank you, everyone.
And it wouldn't, we do have to talk about our next webinar. So I'll let Carrie talk about that. But again, thank you, everybody. In my email, you can reach me at sales@Spruce Health. I'm happy to answer any questions, or, if you want other facts, I'm happy to share too.
Love it. This was such an incredible event. Thank you, Susan, and thank you, Sean. You guys covered a lot of great content, and I know I got a lot out of that. For those still on the call with us, you may want to join next month. We're going to be talking all about virtual assistants. In fact, we're calling this a VA Palooza, because we're going to be partnering with 4 different organizations, all very skilled in healthcare, HIPAA compliant virtual assistants, and they'll walk through what you can do to both support and scale your practice virtually. So if that's of interest, be sure to join us. I'll have a link in the outbound email that will also have the recording of today's event. So thank you so much. This was terrific, and we will hopefully see you all again real soon.
Thanks, everyone.
Thanks,
Great.
everyone. Bye.
Thank you.